Well, happy chapter number 4 in human development. So let's start this exciting process in talking about how life is first conceived. So we're going to talk about prenatal development and birth in this chapter number 4. So some of the things we're talking about is what are the different stages of pregnancy? What are the different ways we can deliver a baby? What's the APGAR scale for those of you interested in pediatrics or neonatal care? You'll want to know about that. What role does dad play in this whole process of pregnancy and birth? And what is FAS? All right. So there's 3 different stages of development when we are having a baby. And the first one's what we call the germinal period. So the germinal period is very short. It's just the first 2 weeks after conception, which means most women may not even know that they're pregnant at that time, right? Then we move on to the embryonic period. And this is week number 3 through week number 8. So week 3 through 8, really we're already starting to see the baby body shaped and formed during this early embryonic period. Then the fetal period is really the longest period of prenatal development. This is week 9 through birth. So when I say week 9 through birth, how many weeks am I talking about, right? What is a full-term pregnancy? So the fetal period should be about week 9 through week 40. So full-term pregnancy, about 40 weeks that we're talking about. And again, so this is your longest stage of prenatal development here. So we'll see, you can read through and kind of understand how a zygote is formed and what the process is for the ovum and sperm to create this life. We mentioned the germinal period just being the first 2 weeks after conception, and during this time we find that about half or 50% of all conceptions actually fail to implant. That means that that ovum, that egg, did not implant into the uterus wall. And for this time, most women, aren't aware that they were going to be pregnant or that they were and that they lost this conception. Then we move on to the embryonic period, remember, which is week 3 through week 8. Here we lose about another 20% of our zygotes during this time. So again, this is just the body usually spontaneously aborting these embryos at this time. Then we move on to what we said was the longest of our stages, the fetal period, week 9 through week 40. And here we see we lose another 5% of our embryos or our zygotes during this time. And so this is why oftentimes a lot of our OBGYN doctors will tell expecting moms that possibly it's better to wait until usually week 12. If a woman gets through 3 months or gets through week 12, it's kind of a positive, or it's seen as a landmark. And maybe it's good to tell all your friends and family or to share all that news, because oftentimes, as we can see from the numbers here, we lose a lot of our pregnancies, right? Whether that be through miscarriage or whatever it be. And so only about 31% of all zygotes actually grow into full-term newborn babies. All right, here you can look at some pictures, 4 weeks, 7 weeks. This is what we're looking at. That's what's going on inside of our pregnant moms. And here let's talk about what we call the age of viability. So the age of viability is week 22. So I just said that a full-term pregnancy is 40 weeks. So what we're saying today is that given the advancements we have in medical technology and in medical advancements, we know that if a mom gives birth at least 22 weeks or later, there is a very good chance that this premature baby will survive with medical intervention. That means your preemie baby will be hooked up to machines, right? That there will be a breathing machine, we'll be feeding them intravenously, they'll be in an incubator, all of that stuff is going to go on. However, it's very, very positive in the sense that at least we're at week 22, which is what we call the age of viability. And the reason that we need to be at week 22 is because of brain development. That baby's brain needs to be developed enough that if we work the lungs and the heart and help all those things to work with machines, at some point, the brain is going to be able to take over and to make sure that their body is regulating and doing all of those things on its own. And when babies are born under 22 weeks, we just have found that not to be the case, right? So all pregnant moms are looking forward to that week 22, right? And again, you can see the amazing development of our babies. I mean, look at this right here, talking about premature babies, preemies. This is a baby here who was born at 26 weeks, almost 27 weeks, weighing in at 8.6 ounces. How many ounces are in 1 pound? So there's 16 ounces in 1 pound, meaning this baby is half of a pound, half of 1 pound. You can see the baby in comparison to a hand, right? And see how tiny that baby is, weighing in at 8.6 ounces. However, because this baby was born after 22 weeks, this baby is more than likely leads a normal full life, right? I know when I was pregnant and expecting, I mentioned to you, I was an older mom at 40 when I was expecting, and I had a girlfriend who was 27, and she was also expecting, and our babies were going to be born 2 weeks apart, and we both were going to have girls. We were very excited. My friend at about, she must have been at 29 weeks, she developed preeclampsia, which is a toxic condition in which she delivered early. And her baby was born at about, I think it was 2.5 pounds. And so her baby was a preemie. However, when I saw her 6 months after I had delivered my baby, which would have been at a full-term delivery, looking at our girls at 6 months, our girls were exactly the same size. So despite the fact that I had an almost 8-pound baby, and she had a 2.5 pound baby, within 6 months, those children were exactly the same. And that's what we're saying here, is that if you're born premature, as long as there's not other complications that might hinder development, more than likely they're going to catch up to their age group and excel. Right, and again, when does labor start? It starts when the baby tells us it's going to start. So that fetal brain, it's actually the baby's brain that will signal mom and get that uterus going and contracting and saying it's time for me to come out, right? Typical labor for first babies, about 12 hours, right? It's different for many different moms. We'll talk about some of the different ways we can deliver here. You can look at kind of what an uncomplicated normal birth would be. So for our newborn babies, these are the things we want to hear, right? So when you're in the delivery room and you're giving birth, you are listening for a sound. And what is the sound we're listening for? We want to hear a big cry, right? We want to hear our baby cry because that might mean everything's okay. All is good. Now, why is your baby crying? The reason that our baby is crying is, picture this, for 9 months or however long that baby has been inside of mom's uterus. It has actually been drinking amniotic fluid. So it has been fed all of its food and nutrients through this cord, umbilical cord, and it has been drinking in this amniotic fluid in that sac all that time. So all of a sudden when this baby is delivered, it comes out and it goes, and it inhales air for the very first time, and that air hits those lungs, and the baby goes from drinking a liquid to inhaling air. And it's kind of freaky, right? So they let out this big cry that says, I don't know what this is. It kind of hurt my lungs and it feels different, all of that. But it's a good thing because when they're crying, they're breathing. And so we want our babies to be doing all these things on their own. The Apgar scale is what our staff, our neonatal staff, will use to evaluate the overall health of the baby. So typically, right, moms, they may take that baby and they're going to do a couple things with them, take some measurements on the side, and then give baby back to you. They're checking some things. They're checking their heart rate. They're checking their breathing. They're checking their muscle tone, their color, their refluxes. They're checking all of these different things, and they do it twice to make sure everything's okay with baby, right? And so they give them a score. We want to make sure that we don't need to do any intervention right away for that baby, right? And so these are kind of, again, all of the things that we're checking, muscle tone, all of that. So medical assistance really means that, you know, today most moms in the US, when they are going to have a baby, they go to the hospital. They want to have sterile procedures. They want to have a sterilized room. They want to have monitors monitoring the baby's heart rate and mom's heart rate. You know, they may want to have drugs, you know, all of that different type of thing. So here's a couple of different ways that we can deliver children that are different from a natural birth, right? Epidural is when mom will actually receive a drug, and this is actually a big long needle that mom gets inserted into her spine. And what happens is when they insert that needle into your spine, it then sends a drug down both of your legs, and it basically numbs you from the waist down. So what will happen is you'll go from feeling contractions every minute or two to all of a sudden you really don't feel much, right? You might feel pressure, but you don't feel the contractions. So for mom, it might be pretty good because it's like, oh, thank goodness, right? On the other hand, it does delay childbirth because now you can't feel when the contractions are coming. And so it may extend the period of childbirth, but lots of moms are for drugs. Another way that we can deliver is through what we call a C-section or cesarean birth, right? A third of our births are done through C-section. C-section should only be done in terms of a medical need, right? So that means there's something wrong with the baby. The baby is not positioned correctly. The umbilical cord is around the baby's neck. There's a danger to mom or baby. That's when we want to actually cut mom and to remove that baby from her instead of having her do a vaginal delivery, right? Cesarean section may be easier for mom in the sense that they are going to drug her and she will not feel the surgery. However, the afterwards is going to be more difficult because you have actually cut through muscles and you have, you know, it's like going through any surgery. Induced labor is when we're concerned because mom is now beyond 40 weeks, or mom is just, labor is taking so many hours for mom. She's at 25 hours, she's at 30 hours, and we're not seeing any continuous movement towards delivery. So we want to then give her a drug. So we will induce labor, meaning start or strengthen the labor process to help it get going or come along, right? So we really don't want, because there's some different things that are going to happen if we leave baby inside of mom for 41, 42, 43 weeks. We really don't do that. All right. Another way to have babies, you can have babies naturally at home. So even though most women in the US do prefer to go to a hospital to have children, by no means but are you required to by law. You may have a child at home. And so a doula is what we think of as a midwife. So it is typically a person, an individual who is very knowledgeable, who has delivered many babies, and who will assist, you kind of like mom's coach, and assist her in childbirth. And a doula can go with mom wherever she wants. So if mom wants to have a home birth, a doula can assist her at home. If mom wants to have give birth in the hospital, a doula can do that. Excuse me, I actually had a doula. So I had a best friend who had 3 children, and she had a doula deliver all 3 of her children. So when I was expecting, she said to me, I really recommend this lady, and actually hired her, and it was the best decision I could have made. She literally thinks of things, doulas think of things that you would never have thought of. She had delivered over 200 babies. I felt really secure in her knowledge. She was with me from the time I went into labor, even visiting me after with my baby at home nursing, right? So that's what a doula does. All right, so we talked about C-section or cesarean birth. Again, it is surgical birth. That's what a C-section is. It means that we're going to go ahead and cut through muscles in your lower abdomen area, cut into the uterus is what we're doing, and we're removing that baby that way. So we say it's controversial, and the reason we say that is because it used to be that C-sections were really only done when there was a medical reason. And then we went through this phase maybe 20, 30 years ago where women started to say, you know what? Instead of going through all that labor, all that 15 hours of pushing, I'll just have a C-section. Just schedule me for surgery. And women started to have C-sections for non-medical reasons. And we really don't recommend that. We don't recommend surgery for any reason that's not necessary. And so that's why we would say it's controversial, because, some doctors were for it, some were not for it. Moms were kind of, taking advantage of it, things of that nature. And then insurance companies started to say, we don't really want to pay for it if it's not a medical reason. If you look at this picture here, what we're saying is that although a C-section is easier in the sense of labor, mom doesn't have to go through 15 hours of pushing, hopefully. It's more difficult afterwards because, again, as you know, newborns require all of your attention all of the time. And so mom is going to struggle a little bit more with getting up and down because you've had major surgery. So getting up and down frequently, your body needs to heal from that surgery. So it can be a little bit more challenging. Right, what is FAS? FAS stands for fetal alcohol syndrome. And what that means is that basically mom consumed excess of alcohol when she was pregnant. So the embryo, the baby, has been exposed to heavy drinking, and therefore they develop this condition called fetal alcohol syndrome. And as soon as the baby is born, we will know that that is the case. A lot of times these babies are premature. So we can see here, there are a lot of consequences for fetal alcohol syndrome. There are some, typical facial deformities. There's some intellectual or cognitive mental retardation issues, learning difficulty, hearing, vision problems. For that reason, you have endangered the life of your child through alcohol, or whether it be through drugs too. Your child will be removed once it's born. And so in these cases, this is when we have CPS step in and place this child into a home until mom or caregiver can prove that they're able to take care of this child without endangering it. As I've shared in my bio, I'm a foster parent, and I have a couple other moms in my group of foster moms who take in these babies, and it is so much work, and it's so heartbreaking to watch, because literally just as somebody who stops drinking alcohol or somebody who's addicted to drugs and they stop taking drugs, these babies go through withdrawals when they're born. So their body has come to depend on the alcohol or the drug. And what happens is when they're born, we actually end up giving them some alcohol or some of that drug in a safe way, because it's too dangerous for us to completely cut it off when they're going through withdrawals and they're so tiny, and they're usually so vulnerable to health risk when they're born. So it's really, really sad to watch this, but there have been moms who have realized mistakes and have been able to go through classes to get clean and to eventually be awarded custody of their child again. But that is what FAS is, fetal alcohol syndrome. Right, some of the things that moms should be looking to do before pregnancy. Okay, so what's dad's role in this whole thing, right? I mean, because obviously moms carry babies, right? Moms give birth to babies. So, what does dad do? This is fascinating, but truthfully, research shows that dad's presence at birth reduces the likelihood of birth complications for mom and or baby, right? So that's research. What we mean by that, by dad's presence at birth, we mean he is somewhere in the vicinity. Let's say you and dad, this pregnancy was not planned per se, and you and dad are going to have a child. You and dad are not going to continue your relationship. You're not going to live together. You're not going to be together. However, if dad is still there, it's more helpful to mom, all right? So mom, you may not want dad in the delivery room, right? You may be wanting to shoot bullets or darts at his head right now, however you feel. But if dad is in the hospital and dad is in the cafeteria or just waiting outside, there's something psychologically that happens with knowing that there is some form of support for this baby, and hopefully for you. right? That's what we care about. Because remember, when it comes to relationships, we're going to talk about, you have your own personal feelings about your partner or ex-partner, but that baby is completely innocent of any of the issues in or conflict in your relationship, and they deserve your full attention and your full care from both of you. So dads, be involved. Moms, let dads be involved. All right. Postpartum depression, or experiencing some problems after birth. First of all, women experience lots of problems after birth. Understand, for 9 months, there was all these hormones that were in your body creating life, right? Doing all these jobs, and all of a sudden you deliver, and now your body goes through a huge transition of getting rid of all those hormones and everything that's going on. And so you may have swollen legs, you may have, your emotions are off the wall. Literally, you're bouncing off the wall. You're crying one minute, you're ecstatic the next. I mean, I was 40 years old when I delivered. You would think I had a doctorate degree at that time. I was someone who was rather accomplished. And I remember my mom came to stay with me for the first week after I gave birth. And then she had to go back to work, and I cried. I'm 40 years old, and I was crying because my mom was leaving me alone with this baby that needed my full attention, along with my 2 other children I had at the time. So, we are very emotional and hormonal during this time. And one of the big concerns is what we call postpartum depression, which means that mom is really unable emotionally and mentally to connect with baby. Mom may not be able to change diapers. Mom doesn't feel like getting out of bed. Mom doesn't want to feed the baby. Not that mom is mean, but that there's something going on hormonally inside that's off balance. And we need some drugs. We need to regulate those hormones so that we don't feel sad all the time at a time that we should feel like really happy, right? All right, we can again look at the number of our moms that are dealing with food insecurity, or single moms that are really struggling on their own. So our newborn babies, again, there's some different things that your newborn. So remember, think of newborn as, really tiny and young. And these babies can't really communicate other than crying, right? And they really can't communicate their needs. But there's some ways that the newborn baby's body works to protect itself. So some of those things are, in order to maintain their oxygen flow, your babies, along with breathing, are going to do things like infants will frequently hiccup a lot. Like they'll go through like 10 hiccups in a row. They'll just get into these fits of hiccuping. Sneezing. These are ways that their body is trying to regulate the flow of oxygen, because remember, this is a new process for them. Maintaining constant body temperature, right? So a lot of our babies will shiver. They tuck their legs under their body. They curl up like a ball. If you have your baby in the hospital, when you go to leave the hospital, one of the things they teach you is what we call swaddling. They teach you to basically swaddle or make your baby into a burrito, right? They lay out a blanket at an angle, and they put the baby there, and then they wrap this baby up all ways, and all you see is a tiny face right there, right? And you leave the hospital with your baby swaddled like that. The reason is this: your baby needs to have this warm, constant temperature. Remember, baby was inside of your uterus, nice and toasty, never really knew what cold was before. All of a sudden, they're out in the air. And so they don't have the fat that you and I have to protect us from the elements and the weather. And so they need that swaddling, and their body will shiver, and their body will do what it needs to do to regulate their body temperature. And then feeding. So our babies have what we call this rooting reflex. And the rooting reflex really means that if we were to go and we were to gently touch our baby's cheek like this, what would happen is that baby automatically turns and starts to do that sucking motion that I want to eat. Because for newborns, they're typically eating every hour and a half or somewhere around there. So it's a constant process. All right, so again, as I mentioned, having that parental alliance, meaning mom and dad have talked and discussed about how we want to raise this baby, what expectations do we have of each other, what commitments are there, even if mom and dad are not together, even if mom or dad has another partner, even if that's the case, you're still both biological parents and therefore should be involved in this baby's life. What kind of support, not just financial, but what kind of childcare support, what kind of just helping me when mom is stressed out about everything she's dealing with, taking the baby for some time, different things like that. But again, your baby deserves that parental alliance. And bonding. As we can see here, bonding is just something that is so easy to do with our newborns, right? They will just unconditionally love you. You can even hurt them and they would do that. And so that bonding is something important. These are great times to have that early connections, right? This is fascinating, but you see here a picture of what they call in the Philippines, Kangaroo Care. And Kangaroo Care, if you look at these babies, all of these babies were low birth rate babies. So they were premature babies, or they were born underweight. In order to expedite or to help them gain weight or get healthier, what they've done is what they call Kangaroo Care. And that is wrapping a naked baby on naked mom and wrapping them together, similar to a kangaroo that has a pouch in front and her baby she carries in the pouch. We're wrapping them together, and research has shown that these babies heal at a much faster rate than if we didn't do this Kangaroo Care. And the reason really is because, again, that skin on skin contact, but also this baby is the closest to mom as they're really ever going to be outside of the womb. So when they were living inside of mom's uterus in her womb, they could hear her heartbeat. They could smell her. They could hear her voice. They felt her blood running through her body, all of that. And all of a sudden they don't. And so when we do this Kangaroo Care, they're back on mom, hearing her heartbeat, smelling her skin, right? Being as close to her as possible. And there's real healing in touch. We'll learn that when we continue to talk about human development. Touch is a powerful tool to use in the healing process. All right, so go ahead and read through your clicker slides, answer your questions, and make sure that you kind of got the information necessary. And we will then see you for chapter number 5.